It is live now.
We are live now.
Hi, everyone.
Hi.
Hello, hello. Happy New Year.
Happy New Year, Prableen. Hi.
Hi, Praveen. Hi, Punam.
Dr. Sharad.
Hi, Mitra.
Hi, hi.
Hi, Sharad. Happy New Year.
Same to you, Punam. How's the year been thus far?
Very good. We got some funding.
Great.
All right, let's begin. I think, Prableen, shall we begin?
Just checking with the tech team. Good to go?
Yeah.
Okay, good afternoon, Zindabad. Happy New Year to all of us who are joining today. I think, like always, PFI and ARC have set the tone for the year of collectivization, of bringing people together, and of a spirit of solidarity. And with that, we hope that this new year for all of us is also about all of these milestones and much more that we wanted to do. Today, it makes me really feel proud to actually introduce an amazing panel and an amazing process that was set up by one of our stalwarts in the sector, Population Foundation of India, and we have folks from there. So I will not share the codes that they have and the brilliance that they're putting up for all of us in the field. But it's my honor to actually invite the folks from PFI as part of the Advocating Reproductive Choices Coalition, which of civil society organizations, many of you who are on this call today. We're a coalition of about 115 organizations who've been working since 2005 on sexual and reproductive health rights and choices, trying to understand how can we advance access to quality family planning services in the country. Over the years, we have worked on a strong mandate to expand contraceptive choices, to improve quality of care and ensure availability, accessibility, and affordability of family planning services across several states. I'm proud to say that this secretariat was first held by Parivar Seva Sanstha till 2015, which was then taken over by Population Foundation of India. And after a fabulous journey of...
One minute. No, from Parivar Seva Sansthan, it went to FPAI, Family Planning Association.
Yeah.
Sorry. Our failure in not keeping you informed.
Not at all, not at all. I think that's the beauty of a coalition, that it went to so many of us. And then to Population Foundation of India, who's been doing this work fabulously of bringing together. And I think I would quote actually Poonam here to really say that how do you really walk the talk when you're talking about meaningful youth engagement and meaningful youth leadership. And I think this coalition has been able to showcase that when the secretariat was passed on to the YP Foundation, which is a young feminist organization based out of Delhi. And we've been working across 22 states on reproductive rights and choices for adolescents and young people. And it's also a pride to be a part of a co-learning and co-creating space like ARC, which is the secretariat that we're holding now. As like I said, that with about 106 general body members across 5 states of Bihar, Jharkhand, Madhya Pradesh, Rajasthan, and Uttar Pradesh, we're happy to sort of bring in experiences across these states into the process with partners, many of you who are in this call today with our dear partner and ally, Population Foundation of India. We're bringing this webinar. So thank you so much for coming in and for participating and giving in your support for this. And I will pass on to Sangamitra to actually lead us into the discussion and to the fabulous webinar. Thank you.
Thank you. Thank you so much, Prableen, and a very good afternoon. And thank you all of us for joining us today. Before we begin, I'd like to inform everyone that this webinar is being recorded. And I'd request all participants to share their questions and comments in the chat box. We have a Q&A section at the end of the panel discussion, and we will try to cover as many questions as possible. Population Foundation of India uses evidence-based strategic engagement as a key approach to inform and stimulate dialogue with policymakers, thought leaders, and the media by providing compelling evidence on issues related to family planning, sexual and reproductive health, adolescent health and well-being, gender, and broader population issues. Strategic engagement is an important process that aims to increase knowledge and understanding of policymakers and thought leaders on specific issues and supporting the process of evidence-based policymaking. It is a sustained process fueled by strong leadership, subject matter expertise, effective messaging, and coordination among diverse stakeholders. Population Foundation of India has developed a Strategic Engagement Handbook, a guide to effectively engage key stakeholders to prioritize family planning, leveraging experiences and learnings from our strategic engagement work over the last 5 decades in different domains. The handbook is intended to be a step-by-step guide to support individuals and organizations interested in adopting or already involved in strategic engagement for family planning, or for that matter, other areas of work. The handbook has been informed by global best practices, frameworks, and approaches with India's specific insights and provides information on simple tools that can be leveraged while designing and executing strategic engagement interventions. Please find a copy of the handbook through the given link in the chat box. In the coming months, Population Foundation of India will be organizing orientation workshops on the handbook with select groups of interested organizations. If you or your organization are interested in participating in the workshop, please reach out to us on the email address provided in the chat box. On the occasion of the release of this handbook, we have the privilege of being joined by 3 eminent leaders who have led exemplary work in the development sector to shed some light on critical issues related to strategic engagement. But before we do that, let's watch a short film on Population Foundation of India's journey and how strategic engagement can bring about change in the lives of people. We'll hear more about the impact of PFI's work during the panel discussion. Can we screen the film, please?
Change. How does change happen? When does an idea become a movement? When does hope become reality? At Population Foundation of India, we believe that change must be just and equitable, and is only possible when we work together, and this is what we have done for the past 53 years. The organization was founded 53 years ago by a group of visionaries led by J.R.D. Tata. In 1992, J.R.D. Tata received the UN Population Award for initiating the family planning program in India.
I was motivated by nothing more important than by kind of personal protest against the continuing poverty of most of my country's people. The subject became, for me, unimportant as that is, a personal obsession which still haunts me.
It has been 53 years since Population Foundation of India began making our founder's vision a reality.
I would first like to congratulate the Population Foundation of India for the very meaningful contribution and commitment they have made to create a better understanding of India's population needs.
Over the years, Population Foundation of India's work has focused on the reproductive health and rights of women and young people.
मेरी पत्नी जो है ऑपरेशन के लिए नेवी चेन हॉस्पिटल सकरी के पास 4 बजे ऑपरेशन शुरू हुआ, 6-7 बजे तक ख़त्म हुआ। फिर हॉस्पिटल रिफ़र किए 9 बजे रात में। फिर वहाँ पर 11 बजे के आसपास जो है मेरे पत्नी की मृत्यु हो गई।
Women died, robbed of dignity and choice. Population Foundation of India's advocacy efforts after the tragic Bilaspur incident paved the way for a paradigm shift, improving reproductive health services, family planning, quality of care, and public accountability.
This commitment to women's health and quality of care ensured that the public health system improved and reproductive choices expanded.
ये अतिरिक्त प्राथमिक स्वास्थ्य केंद्र 2013 में बन करके तैयार हुआ था और लगभग 4 साल बन करके यह उसी अवस्था में खड़ा रहा।
Community action, a key pillar of the Ministry of Health and Family Welfare's National Health Mission, places people at the center of the process of strengthening the public health system. As the Secretariat to the Advisory Group on Community Action from 2005 to 2023, Population Foundation of India's work enabled communities to demand and access their health services. Population Foundation of India has emerged as a prominent voice in the domestic and global media, shaping the global discourse on population dynamics. This was particularly evident in the coverage of India surpassing China as the world's most populous nation in April 2023.
Not going beyond primary education means early marriage. So 1/4 of Indian girls get married before the legal age of 18, and there is pressure on them to produce babies as soon as they get married to prove their fertility.
Stepping up for women and young people is key to Population Foundation of India's work.
In 2013, PFI launched मैं कुछ भी कर सकती हूँ, an entertainment education program dealing with family planning issues. It was launched on Doordarshan and then it was dubbed in about 11 languages. So it was also shown on regional networks of Doordarshan. It was broadcast on 262 radio stations, digital platform, artificial intelligence chatbot. Overall, it had a huge reach across the country.
मैंने जब मैं कुछ भी कर सकती हूँ सीरियल देखा तब मुझे बहुत साहस आया। तब मैंने अपने पापा से बोला कि पापा मैं शादी नहीं करना चाहती हूँ, मैं आगे पढ़ना चाहती हूँ।
The real test of a program is the impact on the ground, and it is here that मैं कुछ भी कर सकती हूँ is very special. Lat Kunwar Kushawa, a young girl from Bundelkhand MP, became the first girl in a village to go to a college. Nirma Devi from Patna convinced her husband to use condoms and then became a champion of family planning in her village. The women of Bahria from Bihar meet every week to discuss domestic violence. That is the true test of a good television program.
Population Foundation of India works with young people across Bihar, Rajasthan and UP, among other states, to create safe spaces that empower them to take informed decisions about their health.
मैं अभी गांव-गांव में जाकर के जागरूकता फैला रही हूँ। जो भी मैं काम कर रही हूँ उससे सबको जोड़ने की कोशिश कर रही हूँ। हमारे गांव में या दूसरे गांव में जितनी भी महिला हैं, जितनी भी लड़की हैं, वो अपने मन का कर सके।
To engage efficiently with adolescents and young people, Population Foundation of India has developed multiple tech-based interventions. The SNE AI chatbot provides an anonymous, secure, and non-judgmental space for young people to access verified information related to safe online behavior and their health and well-being. Educately is Population Foundation of India's e-learning platform, offering courses on adolescence issues. In 2022, the organization piloted an initiative on using virtual reality for augmenting nurse training and family planning counseling. Even as Population Foundation of India embraces the future, its core mission remains the same: putting people before numbers.
In our mission, the journey is the purpose, and the destination stretches beyond forever. We stand committed to achieving our goals with all the resources and strength we have. A dream never ends, and it will come true.
Without much ado, I would now like to introduce our eminent panel. Ms. Poonam Mutreja is the Executive Director of Population Foundation of India, who for over 40 years has been a strong advocate for women's health, reproductive and sexual rights, and rural livelihood. She has co-conceived the popular transmedia initiative Main Kuch Bhi Kar Sakti Hoon, I, a Woman Can Achieve Anything. Before joining Population Foundation of India, Poonam served as the India Country Director of MacArthur Foundation for 15 years and has also co-founded and led the Ashoka Foundation, Dastakar, and Shruti. She's a member of the Governing Council and Board of ActionAid International and India, and is a member of a Committee on Population Dynamics and Women's Empowerment at the National Academy of Sciences, Engineering and Medicine, Washington, D.C. Dr. Abhijit Pathak is the Chief of Party and Country Lead Family Planning, Gender and Youth at JPIGO. Abhijit has 20 years of public health experience in India and Southeast Asia. Prior to joining JPIGO, he was working with the Bill and Melinda Gates Foundation as a Senior Program Officer, managing the family planning investments of the India Country Office. In the past, he has served as a UNFPA-supported maternal health consultant to the National Health Mission Madhya Pradesh, managed a portfolio of investments for the India office of SIF UK, has served as the Senior Technical Advisor at the South Asia Regional Office of IPPL, and has managed innovative and award-winning projects in healthcare, IT, health financing with organizations such as Infosys, IFMR, and CARE Hospitals. Dr. Sharad Iyengar is the Chief Executive of Action Research and Training for Health, that is ART. The organization works on research, service innovation, and training on issues around sexual and reproductive health, neonatal and child health, and health systems. Trained in pediatrics and public health, Dr. Iyengar previously has also been associated with UNFPA India and has been a member of various high-level committees of the Ministry of Health and Family Welfare, Government of India, as well as the Government of Rajasthan. He's also a steering committee member of Common Health. A very warm welcome to all our dignified panelists. My first question is to Poonam. Poonam, what has been, according to you, some of the key achievements, opportunities, and challenges for Population Foundation of India related to its strategic engagement work? Poonam, you're on mute.
Thank you, Sanghamitra, and thank you, Prableen, for being our co-host and saying the very nice things you said about ARC, PFI, and we all reciprocate and love working with the young people in your organization and you. Much has already been said about PFI in the film that my colleague sneaked in. So I'm going to be short and brief, and because people will get quite bored and fed up with listening to so much about PFI achievements and showing off, but I'll focus more on the challenges.
And I have to share with everyone that recently we did a strategy exercise to re-look at, given the changes in the world, in the country, not just demographic changes, but the political, social, and other changes. And when we were doing our strategy refresh and we spoke to a few experts, especially some donors, we were told that PFI keeps talking about issues but doesn't talk about its work. So with a vengeance, my colleagues have brought in the film and want me to talk about our work. These are my colleagues and bosses who planned the seminar. So with that disclosure, I'll start. So over the years, as you all know, or many of you know, we've employed diverse approaches to further our mission, and which has positioned us as a technical partner, not just to government, but for capacity building, providing evidence, to a lot of our programs where we work closely with the government, both at the national and state level. We've leveraged the media, as some of you also know, to amplify some of the critical messages and shape the public discourse on population, gender, family planning, and related issues. And here, there are many reasons why we have this handbook, but we would really like a coalition of some of us NGOs that speak to the media. I think I myself have been bored with the number of interviews that in the media that I've had to do, and my colleagues, of course, increasingly are doing many of the media interviews. Not only my colleagues, you just saw Masum on the screen, who at the end was talking about in our film, who is one of the adolescent or young leaders that we work with, or champions we work with in Bihar. I'm very proud to tell you that often now we get requests from the media, not for me, not for Sangamitra, not for other colleagues, but for Masum. So we want to expand the number of us who comment, and we collectively shape the discourse. Over the years, we've leveraged the power of collaboration, and honestly, the ARC network has been a great opportunity, and I say I'm sure you recognize that, my colleagues, the membership of the coalition, as well as Prableen and colleagues at the YP Foundation, recognize how much you can leverage the power of collaboration and networks, especially at this point of time when, individual lone voices there's a little fear, there's a little hesitation, there's trepidation, and a collective voice is always powerful. But at this point of time, it is in the socio-political environment, it is a smart strategy and an effective strategy. So not only ARC, but the advisory group on community action, which Sharad has been part of, we have also leveraged to strengthen institutional capacity of state-level members, align messages, and amplify the collective impact of the strategic engagement. What is strategic engagement? It is really anyone you engage with. It's not just strategic engagement with government, but it's anyone you engage with strategically. One, for us, strategy means never missing an opportunity. If somebody makes a good statement or a stupid statement or a bad statement or incorrect statement, PFI will never miss an opportunity to put the right perspective on what happens. And if good things are being said, we do also comment there and congratulate or support people who, especially in the political and public service, we support people who do that in different ways. We are constantly providing the right data, which will lead to the right decisions through many strategic ways, engagements. And, it's interesting that recently Gates Foundation, where Abhijit was very much part of some of the work that was supported by Gates Foundation to PFI. He was very much part of the team that supported us at BMGF for our strategic engagement work. I would like to say here and recognize and give credit to the confidence and BMGF put in us by supporting us to do a lot of the strategic engagement, including this handbook, as was said earlier by Sangamitra. We never missed an opportunity to engage with people in the media, not just in the media, but in the political sphere too, across states and at the national level, where we knew that the demographic changes or the demographic needs or reproductive sexual rights and needs of young people and older women were not understood well. So that is another part of the strategic engagement, to the extent that we have been able to, there is so many myths and misconceptions about family planning in numbers, even wrong numbers are given, especially when it comes to, let's say, the fertility rates of minority communities or the involvement of men. Why don't men engage? So on all these issues, or the the very popular expression, two-child norm, we need a two-child norm, we need coercive population policies, we need to follow China's example. So all of this we have, through strategic engagement, changed people's minds, corrected their misconceptions. Advocating choice-based family planning is another area that PFI has strategically worked on through its Realizing Commitment to Family Planning project since 2014, again supported by BMGF. And the quality where the project, the work we've been doing is based on changing and improving quality of family planning services at the national level, collaborating with key stakeholders, policymakers, influencers. So PFI positions family planning also in a broader context and agenda. In the past, Strategic Engagement Handbook has also been developed, as I said, to serve as a comprehensive guide for effective strategic engagement and implementation, further advancing the family planning commitment to shaping the discourse around family planning at both the national and grassroots level. PFI strongly believes that advocacy and changes and strategic engagement cannot be just at the national level or with senior political leadership or policymakers. It has to be all levels. From grassroots, there has to be a continuum from grassroots to the national level. So PFI has countered, as I said earlier, calls for a two-child policy through extensive media coverage and sensitization efforts, which has resulted in the affirmation from government officials, including we were asked once by a senior advisor, a close advisor to the government, the central government. We got a call when we were making a lot of noise in the media, and we were really scared when we got this call from a particular gentleman who said, "What do you want?" And we thought, oh, we're in trouble. But what he asked us, what he said to us is, we've been listening to you. We've been reading what you all are saying. Just tell us what you want. And we are going to discuss it at the highest level. And so we were asked to give a 2-page note in what we wanted. And let me read out to you what, using our language, it resulted in a statement in Parliament This is at the peak of the two-child norm debate, especially in UP, where there was a big push for the UP population policy to be very coercive and to had the policy had hoped to penalize one community. At that point of time, we get this call, and which resulted, as I said, in affirmation from government officials, including a statement in Parliament by Ms. Bharti Praveen Pawar, who was the Minister of State, Ministry of Family Welfare, Health and Family Welfare, reiterating some of the arguments Population Foundation of India made on its notes and statements on the negative implications of the two-child norm. The ministry had also submitted an affidavit to the Supreme Court stating it is unequivocally against forcing people to have only a certain number of children in a bid to control the population. This is, as you know, there was a PIL, many of you will know, there was a public interest litigation filed by a BJP member, a lawyer, for the courts to ensure that first the High Court and then he went to Supreme Court for the two-child norm to be implemented, which was dismissed. And we were able to help the government with the ministry with the affidavit that they gave, which was totally, as I read out, against a two-child norm. So another area going back to UP, many of you know, we drafted a rights-based and women-centric state population policy, successfully advocating against coercive measures like a two-child norm. And believe me, we can write a case study, but this is not politically the right time, but it is an amazing experience where the chief minister of UP, who wanted a two-child norm policy, his mind was changed with support, total support from the bureaucracy in the UP government by our strategic support, where we kept giving them evidence to show we needed a rights-based policy. And ultimately, when the chief minister released the policy, he was very proud to present what PFI presented to him for what PFI drafted for presenting the population policy, that it was a women's empowerment policy and it would be good for the state, but it would be good for the chief minister politically. So you have to be strategic where you end up making a chief minister feel it's in his interest, political and interest of his state, to present a rights-based women's empowerment approach. And all of this learning and the lessons that we got, we have tried to capture in the handbook. And I want to say that what you saw, many of you know about the Supreme Court judgment in 2016, the Devika Biswas versus Union of India case, which mandated the phasing out of sterilization camps within 3 years of the verdict, is a significant achievement in recent Indian civil society movement. The tragic incident in 2014, wherein 16 women lost their lives in a mass sterilization camp in Bilaspur, Chhattisgarh, served as a catalyst rallying point in uniting all the NGOs. ARC played a role. Members of ARC joined PFI team in doing an investigation. It was the fact that it was a civil society-led, coalition-led group that made the difference. It wasn't just us who did the report. Sama and others also did. Jashodhara and various others did another report. So with all of us working on different aspects, we ended up being a powerful voice, the civil society. It is not about PFI. PFI was there perhaps at the right time, but it was the collective voice, I want to say, of the NGOs, not just when the 16 women died, but from earlier on, we had all been advocating. And finally, I want to say that recognition, I have 1 minute left, and I want to deal with some of the challenges, if I may, very quickly. One is, of course, what I referred to the biggest challenge earlier, misconceptions about strategic engagement often get confused with activism or lobbying pose a challenge. Therefore, it is imperative to clarify that strategic engagement is an evidence-based and systematic approach, distinct from transactional focus of lobbying. Measuring the impact of strategic engagement poses a significant challenge. So attribution, that's why I was saying it wasn't just, a lot of people said it was PFI's report that led to this change, but I want to say it is collective work of many, many people. This challenge is compounded by the preference for easily measurable results, which donors have a greater interest in. So advocacy, changing attitudes, establishing a direct link between our effective efforts and specific measurable outcomes is a complex situation. And the donors are moving away from this. So it has become a bigger challenge for us today, for us, not just PFI, all of us. In the current environment, advocacy is seen as not too feasible. However, PFI has effectively employed strategic approaches to move the needle in these times in more ways than one. In the fast-changing world, PFI has also changed very quickly, and if I may say, successfully in many of our approaches. And this handbook see it as a drawing, a painting, which is in the making. And as we all hear our collective experiences, not just PFI's, as we said, even earlier, we took examples and lessons from NGOs, not just in India, but civil society across the world. We hope to continue working on it, and especially on young people's issues with ARC, with the YP Foundation. So I'll end there. Thank you very much, my colleagues.
Thank you. Thank you so much, Poonam, for highlighting the power of coalitions for defining strategic, or shall I say, redefining strategic engagement for us to not just include engagement with policymakers, but a variety of stakeholders. And most importantly, the need to never miss an opportunity, which has really been the pillar of PFI's strategic engagement work. I'll now move on to my next question to Abhijit. Abhijit, could you share your thoughts on how strategic engagement helps sustain, scale, and meet organizational goals?
Yeah, thanks. Thanks, Sanmitra. I hope that you can hear me well. I first of all, thank you to the entire ARC coalition. Thank you to Pravleen for reaching out to me. Thank you to PFI for organizing this. This is a topic that's actually very close to my heart. Having luckily had the good fortune of working on all sides of the table, whether it's donors, government support, etc., and now coming back into implementation and being again sort of driving strategic engagement from the other side. I think a lot has already been said. Some of the important points that have been said, I just sort of so one, collectives are extremely important. And it's very difficult not just to bring people together. I think it's even more difficult to sustain collectives. And so, I mean, and I don't need to tell this to the members of the ARC. It's an extremely difficult task to bring together everybody and to sustain this coalition and to move the secretariat around. But collective voices have a much larger play. I also want to agree with what Poonam said earlier about increasing the number of stakeholders we talk to. But I want to highlight that in specific, something that I have personally experienced gives a lot of sustainability to our efforts. And that is by increasing number of audiences who never thought they could be your audience. So for example, in the current administration, we are seeing that a lot of state subjects that our constitution completely rests at the state level, for example, nutrition or health, even there, the federal control has increased a lot, and a lot of the state audiences feel left out, feel that they are disempowered, feel that their voices will not be heard and nobody will come to talk to them. And that gets exaggerated when organizations and coalitions such as ours don't go to them and talk to them. And so decentralizing our audience, and I mean that by taking that down even to the level of the districts, because you find champions at unlikely places. You find champions in district magistrates who can do wonders. You find champions in focal points and nodal authorities within the states who can really champion innovation. And in fact, Indian public health history is replete with examples that all innovations have started somewhere by the act of a brave, state person. So whether it's the MCTS, whether it's the PMJAY, whether all of these insurance schemes, they all started somewhere from a small player being really very interested in making change. And so decentralizing our audiences is also lends a lot of not just sustainability, but also innovation and local contextualization to the effort. So that's part of the answer. The third is also something that Poonam touched about, but I also want to embellish that a little bit from my experience. And that is, we often hear, and Poonam also talked about, the importance of evidence-based strategic engagement or evidence-based advocacy. I want to flip this phrase a little, and this is for mostly the audience that exists and the young people that are listening. Evidence-based strategic engagement works when there is evidence that lends itself to the story of your narrative. Sometimes that evidence doesn't exist because that evidence was created for something else. So for example, there is only a limited amount of advocacy that you can do with the NFHS data, because NFHS was a survey that collected data not for strategic engagement. And so I want to flip that sentence from saying evidence-based strategic engagement to instead saying strategic engagement inspired data collection. I think we need specific data. I will give you a very live example because UP has been mentioned by Poonam. I'll mention UP. A few years ago, we all remember our Honorable Prime Minister, stated his vision of a $5 trillion economy for India. About a couple of days after the words, we were in a big, large bureaucratic meeting in UP, where the Honorable Chief Minister of UP came up on stage for just 5 minutes and announced that out of that 5 trillion, $1 trillion would be contributed by Uttar Pradesh. Now, this announcement was made and he went down, and we had some health department functionaries. There was a Stephanian who was the MD of UP NHM at that time. He was sitting next to me. And I remember him asking me, how the hell are we going to do this? How are we supposed to take UP to a $1 trillion economy? And I told him, well, you know what, sir, actually UP population is more than Brazil. Brazil is a $1 trillion economy. So on paper, theoretically, you could do it. The problem is that UP is the lowest in women's education, in women's graduation, in women's workforce participation, which means half of UP's population is not working. How do you seek to boost up productivity in that scenario? And he said, so how can we do it? How can health department contribute? And I said, well, you can actually contribute by, women. The biggest shock that takes women out of schools or out of colleges or out of livelihoods is actually an unintended pregnancy. You find married girls in colleges, you never find mothers. And I said, so delaying the first birth or spacing subsequent births or avoiding unintended pregnancies actually impacts your education rates, your livelihood rates, your workplace participation rates. And he said, that makes absolute sense, but do you have any data to back it up? And I must admit, I was part of BMGF team, which made the first ever grant in the world. And it is still not operational. We still don't have results from it. It's a grant with Avenir called FP Goals. But the first ever grant to model the non-health impact of contraception. So even today, all the impact indices of contraception and family planning are unintended births averted, or unsafe abortions averted, or deaths averted, or something like that. We still don't have a numerical factor on how many years of education contributed, or how many dollars of savings contributed, or how many years of livelihoods increased by providing contraception. And we don't have that because that data was never collected, never modeled. And if that's never modeled, then I am at a handicap when I am having a conversation with a stakeholder who says, this sounds extremely interesting. I want to invest in family planning for young people because it helps them get educated. But can you tell me 1 year of family planning or 1,000 CYPs, how much does that lead to education attainment? How much does that lead to workplace attainment and so on? And we don't have it. So not just data-driven strategic engagement, but actually data collection that is driven by the needs of strategic engagement. I think that is a completely missing factor that impacts our sustainability efforts. And the last thing I want to say to end this is that sustainability, especially, I mean, it's generally also a patient game, and one should be a bit patient about it. But the difference with strategic engagement is that you're just not patient, you are in the water, so to say. So I know this is not a very Indian analogy, but the best analogy that comes to mind is surfing. You know, so you take the board in the morning and you go in the sun and you swim up, you know, to the sea for some distance, and you just lie there waiting for the wave to come. Nobody sees the hours you spend getting sunburned. Nobody sees the hours you get tired. And when the right wave comes, you climb on your board and you come home to all the claps and cheers, and everybody claps and says, yay, you rode it home, and you know, what a nice thing to done. But nobody sees that you've been lying in the water for years. And that's the kind of thing that strategic engagement needs, that kind of patience, because when the wave comes, a lot of changes are going to happen very quickly. But till the wave comes, you need people to be in the water. If you get into the water when the wave you see, then you're going to be too late. You're going to miss the wave. So you're going to have to be in those silent waters, waiting patiently, getting sunburned, waiting for the right wave to ride. And so that's going to be my last word. But these are the 4 or 5 things I thought I could contribute. Thank you.
Please, could I be allowed to make a small comment on the very terrific conversation we just heard from Abhijit?
Yes, please.
So Abhijit, I want to tell you that you don't have to get sunburnt and surf to know the information, very good information and point that you made about calculating the economic gains, the gains in terms of maternal mortality, child mortality, and workforce participation. PFI did do a study which, with support from BMGF as part of our strategic engagement, called Cost of Inaction in Family
Cost of
Planning.
Inaction. That's all my ideas have been inspired by that report.
Okay, but I want you to know your ex-organization, BMGF, has commissioned a paper to the American Academy of Sciences to do exactly, I think they were thinking you must have raised these issues often in BMGF, where they were forced to make a grant, or compelled to make a grant, should I say, to the Academy of Sciences in DC, where I'm, Sangamitra mentioned in my introduction, I'm part of. So 12 social scientists. I am not a social scientist, but for some reason I was invited to be a part of this committee. We are doing exactly what you need now. It's on women's empowerment, population dynamics, and women's economic empowerment. So this paper is going to come out. I'm going next week. We are finalizing the paper, and it's going to come out in April. And you will not need any sunburn, hopefully, after that, and advocate everything you need to do. Thank you.
Thanks, Poonam and Abhijit. I completely agree with what Abhijit said. It was a perfect analogy to describe the unnoticed and the unnoticed efforts that go behind strategic engagement work that most of us do. And I'd also like to highlight 2 very important points that you made about the need to focus on a diverse audience and not necessarily the traditional audience that we think of, and the need for contextualizing strategic engagement efforts to make it very, very targeted and focused. Moving on to Dr. Iyengar. Dr. Iyengar, Earth works a lot on building capacities of individuals, communities, and local organizations at the grassroots levels on various issues. What have been some of your experiences and perspectives on the importance, especially of grassroots organizations and individual champions to drive change?
Thank you, Sangamitra. And I begin by thanking Prableen from ARC and Poonam from PFI and colleagues at both these uh, organizations and network for having given me this opportunity. When we talk of grassroots organizations, I mean, there was a time when the term grassroots was always seen as a bit politically loaded. Claim that you were a grassroots worker and then claim access to a lot of decision-making corridors. Nevertheless, it's seen as a location where you know what's happening on the ground, and it brings to a dialogue, to a discourse, the strengths of those who work on the ground. Persons in these situations tend to have long-term engagement. They don't make visits to remote areas and interiors. They kind of live and work out there. And since they have long-term engagement, they tend to be involved in some or the other way in the delivery of some kind of service. You cannot buzz around a community for years or decades and then just claim to be learning from them, understanding them, or studying them. Community members clearly see this as unethical, and therefore tend to have some way of intervening to improve their lot. And the process of intervening or helping that community or working with them is highly educated. It also brings in an understanding of the local language, culture, and idiom. So there are certain strengths to having this kind of a worm's eye view as against, say, a bird's eye. One is that when it comes to areas like contraception, family planning, there is a very keen understanding among those working at this level of the needs, compulsions, constraints, aspirations of those, for example, who would use contraceptive methods. How do they think? What are their lives like? The other aspect also is that how would they respond to an intervention? It's very easy to formulate an intervention, come out with policy and put money and budgets behind it. But the way in which people on the ground react to it is often a little inscrutable unless you spend time to find out how they might respond. And lastly, a lot of those who take decisions, and perhaps that's the way the development sector works, that's the way governments work, that's the way many organizations work. Decisions are made at the treetop, and they may not understand the constraints of frontline providers. So those working at the grassroots tend to have a good understanding of frontline providers, so long as they engage with them. And in the areas of sexual and reproductive health, you've got to realize that people don't open up easily. Especially, I know you're going to think I'm going to say women, no, especially men. Women do tend to open up. It's surprising how frank and articulate they can be, so long as you have their trust. But men tend to be very, very reserved in how they opine. And these kinds of conversations lead us to question certain very common myths that, by repeatedly saying, get believed in. For example, men don't like to participate in family planning. They don't use family planning methods. The reality, perhaps, is, and you can do any number of grassroots exercises to find out, is that men don't like surgical methods. Look at the number of men using condoms. Apart from sterilization, the number one method being used, reversible method, is condom use, both among those in married, stable partnerships and outside it. Men don't like sterilization. Actually, even the women don't like it. There is a lot of sterilization in this country because the women have this understanding that there isn't an alternative. The bulk of those attending this webinar, I can see 77 participants and we 5-6 families. We belong to a social class which does not use any surgical contraception except by way of exception. It is all the alternatives that are popular. So if there are such realizations, what do we do with them? Now we've got to realize that there's also a downside to being at the grassroots level. One is that while you are very aware of the context, it is one specific context. And therefore, you can get overwhelmed by the social, economic, educational circumstances of the area in which you're working and believe somehow that that's what happens all over the country or all over, say, groups of countries, whereas that is not so. So there's got to be a certain humility and modesty in trying to conclude. It's very easy to over conclude. It's very easy for even others to assume that you have the answers. Actually, you sometimes raise more questions than answers. It is dangerous to overgeneralize, and it is even more dangerous to oversimplify what essentially are complex issues. And so, if we want to build the capacity of those who are working with communities and have an understanding of issues like contraception, what can we do to build their capacity? Uh, I would go to examples. Our own organization, when we arrived here, had a medical rep who came and told us, there is this copper T 380. Would you buy it for 200 rupees? And I said, you must be crazy. We get these free copper teas from the government and we're helping the government program. It turned out that this had a 10-year lifespan. We therefore, on a freak idea, called it the 10-year copper tea and positioned it as an alternative to female sterilization. The government of India noticed it, and something like 3-4 years later, with a lot of procedure, the country shifted from the copper T 200D to the 380A. Though unfortunately, it was not seen as a truly long-acting, reversible contraceptive method. Now, if we want to build capacity of those who work on the ground, it's quite essential that we give them an opportunity to understand the science better. It is very difficult to be on the ground and know in an adapted, contextualized way what the science says. It's very easy to become unscientific, carried away by your experiences on the ground. And most people working at that level after some years would not admit that they perhaps don't know all the details. And it's important to, build that capacity without overwhelming them with jargon, in, terms, and in a way tell them, you people don't know all this, all you do is go around buzzing around people and working with them. You don't know the technicalities. That is dangerous. It is important to simplify the science while remaining scientific. Second is that very often those working on the ground have a limited understanding of policies and programs, except by way of their implementation. It is therefore very important to orient them about policies. Where does the money go? For example, in contraception, the bulk of money goes into sterilization, sustaining the ecosystem, the infrastructure to deliver sterilization services. And then there's also a large amount of money going into incentives. And what do incentives do this way or that is important. It's worthy of analysis. And so it's very important that we understand policies. And then I would hark to what Abhijit just mentioned. They need to have an understanding of how do you gather the information, how do you gather the evidence. Now, you don't need a double-blind randomized controlled trial for every piece of evidence. You sometimes need to have very strong observational capabilities. However, given that it's very easy to be misled, it's very easy to get carried away by experiences. And the more you start believing in something, then we all know that a lot of people working on the ground are very activist in their views. And so they start believing in what they want to believe and may not entertain contrarian perceptions. It's important that they learn science behind gathering the evidence and putting it in a manner which is both objective and convincing. And I think this would be a major contribution to informing the discourse, because those who are playing a very vital role in reaching out to decision makers, the examples that Poonam mentioned, of assisting, of listening to those stray remarks or even to the questions, as Abhijit mentioned, the agony and the angst that people in decision making positions have. It is important to get across to them and give them the information from the ground level. So this is an important part of building their capacity, and we have found that this has proved to be a major challenge. People think research is some kind of a holy cow. We also have an environment now that believes that research should be restricted and should be put through a lot of scrutiny, and it's very inimical to research or gathering information. The other thing that people working on the ground find very difficult to deal with is how do you go from, the grassroots to the treetops? So where do you go? Most of us succeed in reaching the lower branches. And pardon my, pushing with this analogy. Abhijit used one also, but here's a more logical analogy. You go to the district level decision maker, you meet a collector. You go to a deputy joint or even the secretary of the state government of a nodal department or a ministry. You speak to the directors and get your point across. These are the people at the state level. And there is a certain manner of engagement. There are things that you need to be articulating, and there are some things that are perhaps left best unsaid. And we found that this is, of course, a function of how you strategize and how you engage. It is important in this that those working on the ground engage with those who agree and also with those who disagree, and also confront the other major problem, the large mass of people who are indifferent. And my own experience has been that in the area of contraception or family planning, there is a very large scale indifference to, political economy, the politics, the social constraints, the social determinants revolving around reproductive rights and contraception. There seems to be this blanket feeling that a sterilization-driven agenda is the best and the only agenda. And look what's happening. Successive editions of the NFHS are showing us that people are moving away from sterilization. There is a progressive, albeit slow decline in sterilization as a contribution to contraception as adopted by married women, the main focus of the NFHS. There is increasing use of reversible options, and there is different use of reversible options. What we have now is attempts to say, look at emergency contraception as part of the contraception that could be used by couples having infrequent sex or where one person has migrated. There is a look at reversible long-term options. And there's also a look at, for example, how a combination of methods at different times would work. In this kind of pragmatic understanding that, look, there is no silver bullet, there is no perfect contraceptive. So I feel that we need to generate an interest in the larger SRH framework. We need to see that those working on the ground are able to put together what they see, what they hear, and what they experience. They need more of the science. They need some more of, sophisticated techniques of engaging people, knowing when to engage, when perhaps not to. And therefore, to get the opinion from the ground going all the way to where the decisions are made and where the budgets are. Thank you.
Thank you, Dr. Younger. Some very valuable thoughts there. Completely agree with you on the dangers of oversimplifying and overgeneralizing messaging, which is something that resonated with what Abhijit talked about earlier for the need about the need of context-specific strategic engagement messages. And of course, there is a great need to make grassroots organizations understand the science of contraceptives. I think many of us, not just grassroots organizations, but many of us working in the field of family planning need to understand the science behind contraceptives and truly understand an issue before being able to effectively engage strategic engagement stakeholders that we work with. And finally, and most importantly, engaging with those who agree, disagree, and most importantly, those who are indifferent. That is a very, very valuable insight. Thank you so much. We will now move on to the Q&A. I'm cognizant of time. We have just about 10 minutes and we have a bunch of questions. So what I can do is I'll probably take one question each for each of the panelists. There's a question from Dr. Nadeem from Japaigo. How can we enhance the capabilities of healthcare systems to provide high quality family planning and reproductive health services, ensuring a significant focus on equity and accessibility for the most marginalized populations? I would like to direct this question to Dr. Iyengar, and there's another question which I think is could be directed to you, and I'll probably spell that out too. Why should grassroots organizations prioritize advocacy and strategic engagement when their primary focus tends to be implementation?
Thank you. Two linked questions and yet important in themselves. The first is this issue of equity and what matters for marginalized groups. And I think that is extremely important. A lot of those who work on the ground are close to those who are marginalized, bypassed by mainstream intervention. And I think there's a vital role that organizations have in reflecting that reality. To give you a simple example, we've been working for 26 years in southern Rajasthan. We all know that Rajasthan has gone through a refreshing breath of fresh air in the form of increasing levels of education. Even now, uh, we deal with 50% illiterate married women of reproductive age group. Only in 2022 did the percentage go below 50%. We're very happy. It's gone to 49%. But the fact is, with another 25% having just done primary school and then dropped out, in effect, you're dealing with three-quarters of women of reproductive age in southern Rajasthan, a rural and a predominantly tribal area, not being able to read, write, and fearing being misled by those who can read, write, and are better educated. And I think the needs, their perspectives need to be reflected. There is a greater emphasis on rights. And I think policy should work for them, otherwise, they don't work. Now, as I said, we need to be saying this mindful of the fact that not all of India is like that. So to give you an example, we have very little use for smartphones. We have very little use for chatbots or for social media messages. These are people who don't use social media. They don't. Most of them don't possess a telephone. So I think that and similar groups, disabled clients, people living with HIV, they tend to be swept to the side. And it is important to create that special space. And this is unlikely to come other than from an experience by those working at the ground level. The other aspect is why should people working at the grassroots bother about these things when they are so busy with implementation? I agree to a great extent with the person who asked this question. It is backbreaking. It's a bottomless pit working to implement and provide some kind of relief or service given the enormous demand. And the demand increases once people start trusting you some years down the line. However, there needs to be a part of the organization or the group that is undertaking this who deals with the fact that some of the lessons learned, the insights gained, need to go to other places, to other similar situations. So that it's not just, okay, I went and did a great thing in something like 50, 60, 100 villages or 3 blocks or 2 districts and forget about the rest of the country. There are lessons to be learned. There are lessons to be taken to the other extent. And that's where strategic engagement becomes important. But I completely agree, it needs separate, distinct, and substantial investment. It's not likely to happen on its own.
Thank you, Dr. Yangal. The next question I feel is applicable both to Poonam and Abhijit. So we'd love to hear from both of you, since both of you have worn both the donor hat as well as the NGO hat. In the face of resource challenges for strategic engagement, particularly within the current funding landscape marked by limited funds, how can organizations effectively engage donors, especially philanthropy and CSR, when it comes to their work on strategic engagement? So we'll start with you, Poonam, and then we'll invite comments from Abhijit. Poonam, you're on mute. I think this is something that we talk about all the time, so it's wonderful to be asking you this question on a webinar.
Why not Abhijit first?
Yes, why not? We start with
Abhijit.
Abhijit.
Come on. You were the recent donor. I was donor 12 years ago.
Well, yeah, actually, so first of all, I want to increase. So the way the question is framed, and I was reading it in the chat box as well. I think it's not why we should do it in these circumstances, but actually it's an imperative to do this in these circumstances. So strategic engagement is most necessary in a landscape where funds are being diverted to other priorities, and some priorities are not being focused on because of various political economy reasons or various reasons of convenience. For example, in CSR, I always say that, if I was a CSR manager and I could sign just one check to one of these government funds or missions like PM Cares or Ganga Cleaning Mission or something and get done with my CSR commitment, why shouldn't I do it? And you have to provide me the answer, and that forms part of the strategic engagement of why shouldn't a CSR manager take a shortcut, of why. And by the way, I want to change that philanthropic answer also. I think, and this is also to some of the earlier question, I think the way we think of funding some of our priorities, as well as the way we think of health systems, needs to change. I mean, if this webinar was happening about tertiary care, we would already be thinking of health systems as mixed health systems. But because we are talking about family planning or contraception or SRH, we think health system is only the government's health system. When we know that young people don't like to visit these government facilities for their SRH needs, and indeed the fastest growing methods are those which are available in pharmacies. And so they will most probably go to pharmacists and chemists. But yet, for us, our health system idea is caged within the government health facility. And the same thing is with financing. My question would be, why shouldn't, when the businesses of the world are investing in sustainability and climate change for no altruistic reason, why shouldn't they invest in family planning and empowering the girls and women of this country to be more productive, to live more meaningful, to deliver more meaningful contributions to their society and their economies? Why should only be restricted to philanthropists and funders? Why shouldn't private companies invest in this? And when will we wake up to the fact that skilling, a lot of CSRs nowadays invest a lot in skilling young people. But then they fall silent of us, telling us, what are the major concerns, why women in their cohorts are not able to translate those skills into livelihoods. And nobody talks about these pressures that we in the SRH community talk about what's the pressure of fertility that Poonam talked about, approving your fertility very early, or what's the pressure of now you're a mother, don't go to college, or now you're a mother, take care of the child and don't go to your job. So these things it's time that we, I think strategic engagement needs to broaden not just its audience, but also its definitions in the way we think of something. In terms of health systems, the future is for mixed health systems. There will not be anything called government labs or private labs. All testing will be done everywhere, just like all tertiary care is delivered everywhere and PMJAY pays for it. Very soon, we will have to reckon with the reality of mixed health systems. Very soon, we'll have to reckon with the reality that investments are investments, and we should stop calling out philanthropists and CSRs as if they are the only ways of financing this work. I think these are all investments in our economy, all investments in our nation building, and I think that's the way it should be looked at and approached, and so that we can broaden our audience as well as our scope. Over.
Okay, great. Do you want me to go?
Yes, please. And actually, now that Poonam, you're speaking, there's another linked question, that how can organizations effectively measure the impact of their strategic engagement initiatives, which is usually the question that we get from donors as well. So how do we address the challenge of measuring impact and also convincing donors about the potential of strategic engagement related work in the current environment?
So Sangamitra, normally, even if you were not the moderator, since you're part of the knowledge management team and the measuring of impact team and indicators and all of that, I would have asked you to answer this question. So you may as well answer it yourself. But I'm going to, please, let me put please there. But I'm going to make an attempt to answer the earlier question and to some extent this one too. So the first, I agree with everything Abhijit said, but Abhijit, this, when I talked about myths and misconceptions, first of all, it is a myth that everybody says population is the biggest problem. First of all, it isn't. It is an opportunity to find solutions and support women, but nobody invests in family planning in the corporate sector. When we started out, now that BMGF has stopped doing funding advocacy work as a policy, I am just wondering, PFI kaise kaam karega? Because our real grant a big grant came from BMGF, and then Packard was the only other organization that dared to fund advocacy. And there also, there are restrictions on their funding in India currently. So in the reproductive sexual field, even other fields, there is no funding for strategic engagement even today. So how are we going to do it without funding? I do believe we have to change our strategy, our language, which you also said, apart from broadening our community. So for instance, behavior change communication can absolutely be used to change some of the norms without having to go through perhaps sometimes the government. You know, the aspirations of the people have changed and their knowledge. While I heard Sharad say they don't use a lot of the poor people don't have access to digital forms of learning or opportunities. Yes, it is true, there's a huge digital divide, but if we look at numbers, there are enough numbers in India, even amongst the poor, especially young people who have part-time, if not full-time, access to digital, not very sophisticated, but digital media. So we have to ways to reach them. For instance, our chatbot, we are still on Facebook, and then we went on WhatsApp, but now we've recently launched The Voice, which is going to be much easier for people who are not comfortable using technology. Now, behavior change, I said we could do a lot of changes through that, not because we are good at doing behavior change communication. I mean, PFI's Main Kuch Bhi Kar Sakti or all our other digital programs, they have been successful, and the evaluations have totally surprised us because the aspirations of the people have changed. They are more ready for change. And a little bit of nudge, push, information, opportunities, solutions which they can find, we can use that. Second, and have the community engage and make demands of governments, including state governments and at the district level and so on. Second, our language has to change. So we have to stop maybe even strategics. We have to find a better word for strategic engagement. It still is a little acceptable, but certainly advocacy and influence in the government is not acceptable anymore. In fact, government gets very upset today, as we all know, with NGOs who take credit for making a change. Or who raise difficult issues from their point of view. Some of the NGOs have lost their FCRA because government doesn't want to be seen as leading a country that has issues like malnourishment and many other areas. Save the Children Fund is a very good example. We are taking care of our children. We don't need NGOs. So we have to do it in a way that is discreet, tactical. Recently we were asked to write a note for PMO on, not recently, about a year ago, on the NFHS results in terms of NFHS, and they wanted to know the truth, so they came to us. They didn't go to what I consider the right organizations, Niti Aayog and Health Ministry. And they asked us for an honest document, but we never shared it with anybody. We were very quiet about it. We were very discreet. My colleagues are going to scold me, especially Sangamitra. I can see her saying, what the hell is Poonam doing talking about this? Because we've never talked about it. So, and we know that that the truth is something that has reached the government. Why has anemia and malnutrition been so stubborn in India? And so you have to do it differently. You can't go to the media and talk about it. You can't raise it in a webinar like this. You have to go to them quietly, give them the evidence and do it. Or what Abhijit said, we need to, the policies that we need to create the evidence. And we did do that successfully when we did an analysis of the budgets of family planning. There are no analysis we could do because it's not disaggregated numbers. So we did an analysis of and tracking of the expenditures. And that led to government not being able to deny that they spent only 0.4% of their meager budget of 1.4% in health. It's 6% of 1.4% of the health budget, which is already meager. And as Sharad said, much of it goes in incentives and in expenditures on sterilization. Either Sharad or Abhijit, I'm sorry, one of you said that. So you have to find different ways, and you have to not position yourself as an advocacy, and you speak individually as much as collectively. Even today, there is room for collective writing we've written as ARC letters to the Prime Minister, the Health Minister, and it has been, they have been receptive. So I do want to say that this government has its own way of listening, and we have to adapt to that. While our colleagues fight issues of democracy and speaking up, we have to find the most effective way to make the changes. As far as the corporate sector is concerned, Abhijit, I believe that if we are able to get more donors on board from global philanthropic organizations, not just funding agencies, I mean CSR, which is what PFI is trying to do, we may shame or we may inspire people in India to be able to invest. And I still feel Melinda Gates, who's a big champion of family planning and puts some money where she speaks, people like her, I've said that in the reference group, I continue to say that she has a convening role in getting some Indian philanthropists on board on family planning. And I think we shouldn't give up, Abhijit, on that agenda. And we are now, you are outside, but maybe sometimes it's easier to conspire. Or maybe we can, as ARC, write a letter to Melinda Gates of BMGF and say that we are having this challenge in India, and we think the champion of all champions, Melinda Gates, she's seen globally as a champion on family planning. She should, when I'm asked a question, I get flooded with ideas, and before Sangamitra tells me to stop talking, and the time shows I've talked too much. Let's spend more time, all of us as ARC, as people committed to enhancing the budgets and expenditures and work on this. Let's work together. Next webinar, Prableen.
Thank you, Poonam. Those were very wise words towards the end. Let's work together. And I think we started with the power of coalition. We started this webinar by talking about the power of coalition, and it's only right that this webinar is being hosted by ARC. Thank you so much, everyone. Unfortunately, we would not be able to take more questions since we are already slightly over time. We'd like to end with a small exercise. You'll see a QR code displayed on your screen. Please scan it, and in case that doesn't work, paste the link provided in your browser. You will be directed to a whiteboard. Could you please type in one word a key takeaway from the webinar, which basically a word that comes to your mind when you hear the term strategic engagement? while the audience is working on this exercise, Prableen, would you like to share some closing remarks with us on behalf of ARC?
I think as the tech has done for me, it has echoed the bright, beautiful, vibrant sentiments that all our panelists have shared. Something that we're actually also seeing on our screens right now. Networking, negotiations, diverse stakeholders. It's the call for this year. The call for this year across globally, but also very important as this year is a crucial year for policy making and policy spaces for us in the country as we look forward. I think solidarity spaces, creating spaces for communicating strategically, as the term that we've used very meaningfully today. I think that's what is the call from PFI, and very much supported by the coalition ourselves. As ARC, we are looking forward to more members, more strength as we go forward in this year, and look forward to creating spaces where we can take our collective voices, be mindful of those, respect diversity, and be able to do disaggregated, disintegrated, but definitely a collective action across different spaces with different groups. Thank you, everyone, for participating. And a huge round of applause to all our panelists for such a brilliant discussion and a start to the year.
Thank you, Prableen, and thank you, everyone. We invite you to make the most of the Strategic Engagement Handbook and share your feedback. Your input is going to be very crucial as we continue to work towards improving this valuable resource. Have a wonderful evening. Thank you.
Thank you very much. Bye.
Thank you.
Thank you.